This is Dr. Jaspreet Singh, Newburgh, New York, talking about benign prostate hyperplasia, a condition that affects millions of men in the United States, associated with changes in urination with weak stream, hesitancy, urgency, waking up several times a night and going to the bathroom. Here we have a patient who has had prostate enlargement. As you can see, the prostate is pushing into the urethra. We're using the Urolift device in helping this patient out. This is the Urolift device that is getting ready to place a stitch. This allows the prostate to be compressed, sweeping it out of the way. Here I'm calibrating how much to push the prostate out of the way. Obviously, experience is needed in calculating where to place these stitches. We've deployed the first stitch, getting back into the bladder and getting ready for the second stitch on the opposite side. Here once again, I'm trying to stay in the same area on the other side of where we previously placed a stitch. We're pushing the side of the prostate in to allow appropriate compression. We're firing the stitch and cutting the excess suture out to keep the appropriate tension needed to sweep the prostate out of the way. I'm taking a look here and I feel as though I can allow a little bit more compression closer to the bladder neck. I'm using a third and final suture. This would be placed closer towards the bladder neck in a technique called a stacking technique. This is an advanced technique to allow the appropriate placement of these sutures in maximizing the appropriate sweeping of the prostate out of the way. Here I'm taking a look to see whether another one is needed. The channel is nice and open. I have swept the prostate out of the way. The sutures are keeping the prostate out of the way, and I can see directly into the bladder. This is the before and after. Needless to say how open that channel is. This patient will go home the same day, a procedure that took 10 minutes in the office without the need of a Foley catheter. He'll be back to his normal activities in the next 48 hours. He will resume sexual activity within a week. A minimally invasive procedure for maximum results. Dr. Jaspreet Singh, Newburgh, New York.